Remember those itchy red spots many of us got as kids? Those red blister-like spots that seemed to pop up overnight and made us feel so uncomfortable? That was likely chickenpox, a common childhood illness. Chickenpox, also known as varicella, is caused by the varicella zoster virus. It's highly contagious and spreads easily from person to person. While it's usually mild, chickenpox can make you feel pretty miserable. Symptoms include an itchy rash, fever, tiredness, and loss of appetite. The rash typically starts on the chest, back, and face, and then spreads to the rest of the body. The good news is, we can prevent chickenpox with a vaccine. The chickenpox vaccine is safe and effective, and it's the best way to protect yourself and your loved ones from this itchy ailment. Let's learn more about this itchy ailment. Understanding chickenpox can help us take the right steps to prevent it and manage it if it does occur. Chickenpox is caused by a virus. The varicella zoster virus is the culprit behind those itchy red spots. Once infected, the virus stays in the body and can reactivate later in life, causing shingles. It spreads easily, especially among children. The virus is airborne and can be transmitted through coughing, sneezing, or direct contact with the rash. Don't worry though, we'll discuss how it spreads, what to look out for, and how to protect yourself and your loved ones. By staying informed and taking preventive measures, we can keep chickenpox at bay and ensure a healthier future for everyone. Chickenpox is caused by the varicella zoster virus. This virus is highly contagious, meaning it spreads easily from person to person. It's important to understand how this virus works so we can prevent its spread. Once you've had chickenpox, your body usually builds immunity to it. This means you're unlikely to get it again. However, the virus can stay dormant in your body and reactivate later in life as shingles. Chickenpox spreads through the air. When someone with chickenpox coughs or sneezes, tiny droplets containing the virus are released. These droplets can infect others if inhaled. Chickenpox is also spread through direct contact with the fluid from chickenpox blisters. This is why it's crucial to avoid touching the rash and to practice good hand hygiene. Section 4. Identifying chickenpox from itch to rash. The most recognizable symptom of chickenpox is the itchy rash. The rash starts as small red bumps that develop into fluid-filled blisters. These blisters eventually crust over and scab. Other symptoms of chickenpox include fever, fatigue, headache, and loss of appetite. Chickenpox is most contagious a few days before the rash appears and until all blisters have crusted over. Section 5. Complications beyond the itch. While chickenpox is usually mild, it can sometimes lead to complications. These complications can range from mild to severe and can affect various parts of the body. It's important to be aware of these potential issues to ensure timely medical intervention. These complications are more common in certain groups of people. Infants, adults, pregnant women, and individuals with weakened immune systems are at a higher risk. This is because their bodies may not be able to fight off the virus as effectively as others. Complications can include bacterial skin infections, which occur when the blisters become infected with bacteria. Pneumonia is another serious complication, where the infection spreads to the lungs, causing breathing difficulties and other respiratory issues. Encephalitis, which is inflammation of the brain, is a rare but severe complication. It can lead to symptoms such as headaches, fever, confusion, and even seizures. Immediate medical attention is crucial in such cases. Another rare but serious condition is Reyes syndrome, which affects both the brain and liver. This syndrome can develop rapidly and is often associated with the use of aspirin in children recovering from viral infections like chickenpox. It's essential to seek medical attention if you have any concerns. Early diagnosis and treatment can prevent these complications from becoming life-threatening. Always consult with a healthcare professional if you or a loved one is experiencing severe symptoms or if you belong to a high-risk group. Section 6. Prevention and treatment, your best defense. The best way to prevent chickenpox is through vaccination. Vaccines have been a cornerstone in the fight against infectious diseases. and the chickenpox vaccine is no exception. It has significantly reduced the incidence of chickenpox and its complications. The chickenpox vaccine is safe and effective. It works by stimulating the immune system to produce antibodies against the varicella-zoster virus, which causes chickenpox. This means that if you are exposed to the virus, your body is better prepared to fight it off. It's usually given in 2 doses. The first dose is typically administered to children between 12 and 15 months of age, and the second dose is given between 4 and 6 years of age. This 2-dose schedule ensures long-lasting immunity. Treatment for chickenpox focuses on relieving symptoms. While the vaccine is highly effective, some people may still get chickenpox, especially if they have not received both doses. In such cases, managing the symptoms becomes crucial. Calamine lotion and cool baths can help soothe itchy skin. These remedies provide relief from the intense itching that accompanies chickenpox, making the patient more comfortable. Over-the-counter pain relievers can reduce fever and discomfort. Medications such as acetaminophen or ibuprofen can help manage the fever and pain associated with chickenpox, but it's important to avoid aspirin in children due to the risk of Reyes syndrome. If you suspect you or your child has chickenpox, consult a healthcare professional for proper diagnosis and treatment. Early consultation can help manage the symptoms more effectively and prevent complications. Always follow the advice of your healthcare provider to ensure the best care.